Hi, my name is Dr. Marwan Sheikh. I'm the director of the Assisted Fertility Program in Jacksonville, Florida. I am going to talk today about embryo transfer, specifically one aspect of embryo transfer, which is doing the transfer with the use of a vaginal ultrasound as opposed to abdominal ultrasound. In the 80s, we used to do the embryo transfer blindly with the patient in the knee chest position as seen, which was very uncomfortable. And the chance of pregnancy at that time was about 5%. Later on, we started using ultrasound, specifically abdominal ultrasound, which helped us identify exactly where the tip of the catheter is and we are able to deposit the embryos exactly where we want them to go. However, there are problems with an abdominal ultrasound. For example, the patient has to have a full bladder, which can be uncomfortable. You have to have two people to do the ultrasound. One person is an ultrasonographer to do the ultrasound, and the other person will be the doctor putting the catheter in the uterus and transferring the embryos. As you see from this slide, the abdominal ultrasound has a wide view of the uterus, but it's very far from the cervix. With vaginal ultrasound, the ultrasound tip is right next to the cervix, and we can get a much better resolution of the cervical angle, and we are able to see the catheter tip much more accurately. This is just an example of an image done with a vaginal ultrasound. You can clearly see the catheter, you can see the air bubbles of the transfer, and contrast that with an abdominal ultrasound where you see the full bladder and the image. You can still see the catheter, but it's not as clear as with vaginal ultrasound. The catheter I will be showing you is the TVP catheter made by Cook. However, instead of that, we are now using the Wallace catheter, which basically does the same thing. It is malleable and soft, so it can negotiate through the cervix and the uterus. You don't have to have a full bladder. You don't need a speculum with the vaginal ultrasound probe, and it's easy to use. It is not cumbersome, and it's comfortable to patient and have a good pregnancy rate.
Embryo transfer can be hampered by problems at the cervico-uterine junction. Examples are deep endocervical glands or Nabothean cysts, or C-section scar tissue, or a severely antiflex or retroflex uterus. The use of the transvaginal ultrasound probe puts us close to that area of problem. With the TVP system, the inner soft catheter and the outer sheath are passed as one unit, with the soft catheter leading the way. The inner unloaded catheter is removed, and the loaded catheter, which is loaded with embryos, is threaded to within 2 centimeters of the uterine fundus. The embryos are injected and the air bubbles are clearly seen with the use of the vaginal ultrasound. In a severely retroflexed uterus, the same two-step technique using the Cook DVP catheter can also be used with great success.
Thank you for your attention.